ऑर्थोनोवा हस्पताल जलंधर जो कि बहुत ही बुलंदियां छू चुकिया है ਅਤੇ डॉक्टर हरप्रीत सिंह ਦੀ ਯੋਗ ਅਗਵਾਈ ਵਿੱਚ ਚੱਲ ਰਿਹਾ ਹੈ। ਇਸ ਹਸਪਤਾਲ ਨੇ 10,000 ਤੋਂ ਵੱਧ ਗੋਡੇ ਤੇ ਚੁੱਲ੍ਹੇ ਬਦਲਣ ਦਾ ਰਿਕਾਰਡ ਕਾਇਮ ਕੀਤਾ ਹੈ ਤੇ ਹੁਣ ਲੁਧਿਆਣਾ ਵਿਖੇ ਵੀ ਇੱਕ ਹੋਰ ਆਰਥੋਨੋਵਾ ਹਸਪਤਾਲ ਖੋਲ੍ਹਿਆ ਜਾ ਰਿਹਾ ਹੈ ਜਿਸ ਦੀ ਲਾਂਚਿੰਗ ਕਰਨ ਲਈ ਸੀਐਮਈ ਕੀਤੀ ਗਈ ਜਿਸ ਵਿੱਚ ਨਾਮੀ ਡਾਕਟਰਾਂ ਨੇ ਸ਼ਿਰਕਤ ਕੀਤੀ ਜਿਸ ਵਿੱਚ ਡਾਕਟਰ ਚਾਵਲਾ ਨੇ ਮੁੱਖ ਮਹਿਮਾਨ ਵਜੋਂ ਸ਼ਿਰਕਤ ਕੀਤੀ।
And when he told me that he's going to start his Orthonova chain and probably the Ludhiana will be the first target, I was too happy. And the team he has chosen is excellent. That most of the senior doctors of the fraternity are here to bless them today, this evening. And I request the chief guest for today, Dr. L.S. Chawla, ex-head of Department Medicine, principal, and the first Vice Chancellor of Orthopedic University, to kindly come and take his seat as chief guest on the dais and take his seat. Give a big hand, please. And also request Dr. Shivani to present a bouquet, to welcome our Professor K.B. Singh. Shivani, I will again call you on stage to present bouquet. I welcome Professor Sri Sharma. Now I will request
forgetting the names of medicine. I wish to, as customary, to name at least Dr. Yuja, Dr. K.B. Singh, Dr. Thopti, Dr. Vasti Gurcharni. In fact, I like to say first names. Harpreet, I know very well. When Dr. entrance, let me stop now because I think in this process we should not waste much time. When Dr. Bhatani, and I read the name of Dr. Harpreet, is that boy who is at Jalandhar and doing very good knee replacement? They said yes. I said them. I remembered very well that they were doing very well. They were the best students and he was probably the best graduate. And I also remember, I have forgotten. I am very happy that old students of DMC are doing very well, not only in Punjab, not only in India, but all over the world. Because I am very fond of traveling. I have been to about 50 countries abroad. And wherever I go, they look after you so well, they meet you, but I want to know what they have achieved. And I remember our dear friend, late Dr. S.P. Khurana. He wrote before he passed away that my biggest treasure is my students. And I find that कि मेरा सब तो वड्डी चीज जिहड़ा मैं सब तो वड्डी कमाई की है जिंदगी च वो मेरे बच्चे ने, मेरे स्टूडेंट्स ने. And they give you so much love, so much respect. I could never imagine that a boy who passed in early 90s, वो मैंने अरे तक याद रखता है. मेरे को उनका ब्रांच बेटी की ओपनिंग इन लुधियाना. I think probably I am the richest man in this world because I have got thousands of my students all over the world for whom I can ask anything and I'm sure they will never refuse me. They will look after me. तो सब तो बड़ी मेरी दौलत, मेरी कमाई मेरे बच्चे ने। हरप्रीत तुम इतने आ रहे हो, वेलकम। लुधियाना बड़ा बड़ा शहर है, बहुत जरूरत है। मैं इनको गल कहना होना, वो मैं हर बार रिपीट करना, which I read in 1957 in a book called Citadel, written by A.J. Cronin. Medicine is not a profession, it is an obsession. It's not an occupation, it's a preoccupation. It's not a means of livelihood, it's a life commitment to serve the patient. The चौथी गल मैं अपने को कहना होंदा सा कि do not run after money, money will run after you if you treat your patient with commitment, with compassion. तो मैं ज़्यादा ना कहते आया, एट द एज ऑफ 79 मैं अपनी इनकम टैक्स के हिसाब नाल पिछले का सब तो ज़्यादा इनकम टैक्स देता है। तो बहुत खुशी होती है तुहानू मिलके, सब मिलके 10 साल जिंदगी बढ़ जाती है होर। बधाई होवे, वेलकम हियर। एंड कंपटीशन नहीं होता, ये हेल्प होती है। आई नो डॉक्टर जूजा, ही इज सच ए गुड ऑर्थोपेडिक सर्जन। वो किन्ने चिर तो सर्जरी नहीं करते, लेकिन आई नो ये उन्होंने को बच्चे उन्होंने को पढ़े हैं, नेचुरली उन्होंने बंदा नहीं उन्होंने सीखा है। सो वेलकम ऑल ऑफ यू, वेलकम हरप्रीत। किसी वक्त किसी किस्म की जरूरत पैंदी है, मैं इस ऊपर जो कुछ भी कर सकना जरूर करांगा। थैंक यू वेरी मच।
In such a short tenure, at such a young age, he has done the maximum number, that is more than 11,000 joint replacements till date. And he is the only surgeon in India, certified by Oxford to perform Oxford partial knee surgery. And he has done advanced instructional course in Oxford for that.
And I know the days when it used to be. What I am here, I'm standing here is just because of Dr. Chawla, Dr. Ahuja. Whatever Dr. Ahuja has taught me, I have brought it into practice, and I think it is working really good. So whatever I am, my personality, my everything, I owe to Dr. Ahuja and my boss MDMG. So not taking much of time, I will just start brush it. A little bit of orthopedics for non-orthopedic surgeons here, non-orthopedic doctors here. So, and I will be talking about advancement in knee surgeries. Can I have the light down? So, just a brush up with arthritis. So, arthritis is inflammation of the joints. It's basically of two types, osteoarthritis and rheumatoid. Only and more than 4 joint areas to be involved. Both sides of the body, they are commonly involved. And all the symptoms are for more than 6 weeks. And RA rarely can occur in children as small as 3 years and may involve only one joint, so you might confuse it with tuberculosis. But it is an autoimmune disease, so the principles of treatment is much different. The principle of surgery is different for rheumatoid arthritis rather than osteoarthritis. And it has to be treated as early as possible. So treatment of RA is mainly drugs initially, surgery is definitely the last resort. So medicine, there are DMARDs, which control rheumatoid to a great degree, and then we have the eternal set, which has changed the life of rheumatoid patients. So I won't be talking much about that. Osteoarthritis. Now this is the aging process. Everyone has to have it one time or the other. And the cartilage, it wears down and breaks up. It's not a disease. So if you look at the cartilage, can I have the pointer? So if you look at the cartilage, it's a smooth covering of the end of the bones and smooth. But with time, what happens then with trauma? There appear cracks and ulcers on the surface of the cartilage, which are very painful, and slowly they increase in size but these ulcers, they never heal. These defects in the cartilage, they never heal, and they're very, very painful. And if they're not treated, they will involve the bone of the joint, and ultimately the joint destroys. It gets destroyed. So here it is. See, the cartilage also has increased in size, involves half of the joint, and you can see here too, it has destroyed the joint, a part of it. And with time, if you don't treat it, this is the picture you have. You have the whole joint destroyed to a great degree. So, these defects are very painful, and the size does not depict the amount of the pain. So a small ulcer may be very painful, and large ulcer may not be that painful. While the deformities take place, this is a common sight in the urban areas as well as the villages. So prevention is definitely better than cure. So you start the exercises early in your lifetime, do cycling, walking, swimming, and keep your weight under control, have a balanced diet, don't have a sedentary lifestyle, and you correct your posture. Parts of treatment, you can have drugs which are to be avoided, injections, braces, acupuncture, and so many of the surgery is the last resort. So injections in the joint from our side is a big no. There is no about a year back. So this guy has had knee replacement on the both sides. It's actually a hemi replacement on the both sides. And you can see the guy squatting on the floor. And he can sit down, cross-legged. So this type of result was not known earlier, neither in our country nor abroad. So he's showing his cards and telling that we are not cheating. Again, a year back. So I'm just showing the cases so you believe that this is possible. This is not a hoax. So old people, they have loss in muscle power, so they take support of the hands to sit down and to get up. That's okay, till the time your knees are working. Old lady, sitting down and getting up, sitting cross-legged as you do it every day in the temple or pagoda. And she might require support to get up. So I've been doing this type of surgery about 15 years from now, much before the high-flex knees came into the market.
It is indeed an honor to be here in front of such an august audience amongst all of you, and I thank Orthonova Hospitals for making this possible. I think we lost the light again, so I'd just like to say a few words while the projector comes back on again. I joined Orthonova Hospital as a consultant orthopedic surgeon specializing in patient-specific knee replacement and arthroscopy. So we are now doing all kinds of advanced arthroscopic procedures such as anatomical ACL reconstructions, MKFL reconstructions, meniscus suturing, and all other things which are not done in any center before. So meniscus is the goal of the knee. So if we lose meniscus, we lose the knee. And ACL too, they say that the loss of the anterior control that. If we can't reconstruct the ACL, we can surely be rest assured that the knee will be gone in about 5 years' time, at least 15 years before its original age. So I have joined Orthonova Hospital as a consultant, and I'm just waiting for the projector to come back. Right. So knee Punjab and probably in India. The performance of knee replacement depends on many things. The longevity, though, depends on many technical issues like axis alignment, component sizing, and fixation. But without going into the much details, optimal alignment is one of the most important factors which determine how long the knee is going to survive a person. The studies, they say that the alignment is appropriate in about 80% of the cases, but most of these studies are based on short x-rays. So when we look at the x-rays which are full-length x-rays, which are called scannograms, the mechanical difference can be up to 7 degrees, which is scary to orthopedic surgeons and can be horrible for the patient. So the answer to that is either navigation or patient-specific joint replacement. Patient-specific joint replacement, I believe, will change the face of joint replacement all over India in the next coming few years. What happens with the traditional TKR is when we take the bone cuts and we implant the same knee into them. So there are some areas which are left exposed, they continue to bleed and they continue to pain with the muscle rubbing on them, as can be seen very clearly in this demonstration. There are also, these are called underhangs. There are also areas called overhangs where the implant is just sitting in air. So there is no bone under it. So there is no platform to support it. Patient-specific TKR is the answer to all of these problems. Patient-specific care helps us plan the surgery much beforehand. We take the MRI or CT scans depending on which company I'm using. So I take the scans of the patient and send them to centers in Germany or in US, which then give us customized jigs, cutting blocks with which we can cut the knee and then implant it successfully, thus increasing the life of the implant purely due to better alignment, purely due to better fixation, due to better fit by at least another 15 to 20 years. So we even have the 3D visualization in which, like Dr. Harpreet just said, like in computer navigation. So we can do the same thing with PSI, which is patient-specific implants. The advantage of there is a registration that is involved with the navigation system, like Dr. Harpreet was trying to find the center of rotation. Although hugely successful, it is not successful in everybody's hands. So other than Orthonova, I'm not sure how many centers are doing navigation surgery very successfully, because it is a technically demanding surgery. PSI relatively is completely straightforward because PSI can give us no registration and there is no requirement for any computer within the operation theatre. All the requirement of the computer is beforehand. Arthritis of the young is what I would like to draw all of your attention to. Arthritis of the young is a dilemma, and of course prevention is the best cure. Early arthritis happens due to the loss of this little friend here. This is the anterior cruciate ligament of the knee, which leads to innervation of cartilage, loss of stability. What happens due to loss of stability is like in a car, for example, if the alignment is not right, the car will lose its tires very fast and it will lose all of its mechanical functions very fast.
ਅੱਜ ਜਿਹੜੇ CME ਹੋਈ ਸੀਗੇ ਵਿੱਚ ਡਾਕਟਰ ਐਲਿਸ ਚਾਵਲਾ ਜਿਹੜੇ ਪੁਰਾਣੇ ਪ੍ਰਿੰਸੀਪਲ DMC ਲੁਧਿਆਣਾ ਦੇ ਸੀਗੇ, ਮੇਰੇ ਜਿਹੜੇ ਟੀਚਰ ਰਹੇ ਨੇ ਡਾਕਟਰ ਐਸ ਹੂਜਾ, ਜਿਹੜੇ ਹੈਡ ਆਫ ਡਿਪਾਰਟਮੈਂਟ ਆਰਥੋਪੈਡਿਕਸ ਡਾਕਟਰ ਬੱਸੀ, ਡਾਕਟਰ ਟਾ ਤੇ ਸਾਰੇ ਜਿਹੜੇ ਵੱਡੇ ਵੱਡੇ ਡਾਕਟਰ ਸਾਹਿਬ ਸੀਗੇ ਇਹ ਆਏ ਨੇ ਤੇ ਇਹਨਾਂ ਨੇ ਸਾਨੂੰ ਕਾਫੀ ਹੱਦ ਤੱਕ ਆਸ਼ੀਰਵਾਦ ਦਿੱਤਾ ਤੇ ਸਾਡਾ ਸਪੋਰਟ ਕੀਤਾ। ਜਿਹੜਾ ਇਹ ਸੈਮੀਨਾਰ ਹੈਗਾ ਇਹ ਅਸੀਂ ਦੱਸਿਆ ਕਿ ਜਿਹੜੀ ਟੈਕਨੀਕਸ ਹਾਲੇ ਇੰਡੀਆ 'ਚ ਕਈ ਜਗ੍ਹਾ 'ਤੇ ਨਹੀਂ ਹੈਗੀਆਂ, ਕਈ ਇਹੋ ਜਿਹੇ ਆਪਰੇਸ਼ਨ ਨੇ ਜਿਹੜੇ ਇੰਡੀਆ 'ਚ ਹੁੰਦੇ ਨਹੀਂ। ਅਸੀਂ ਇਹ ਬਾਹਰੋਂ ਇਹ ਟੈਕਨੋਲੋਜੀ ਜਲੰਧਰ 'ਤੇ ਪਹਿਲਾਂ ਸੀਗੀ, ਹੁਣ ਅਸੀਂ ਲੁਧਿਆਣਾ 'ਚ ਵੀ ਇਹ ਲੈ ਕੇ ਆਏ ਟੈਕਨੋਲੋਜੀ। ਡਾਕਟਰ ਪੁਟਾਨੀ ਜਿਹੜੇ ਹੈਗੇ ਨੇ ਇਹ ਦੂਰਬੀਨ ਰਾਹੀਂ ਆਪਰੇਸ਼ਨ ਸਾਰੇ, ਜਿੱਦਾਂ ਲਿਗਮੈਂਟ ਰਿਪੇਅਰ ਹੋ ਗਿਆ, ਸਪੋਰਟਸ ਇੰਜਰੀ ਹੋ ਗਈ, ਮਨਿਸਕਲ ਜਿਹੜੇ ਝਿੱਲੀ ਪੜ ਜਾਂਦੀ ਹੈ, ਕਬੱਡੀ ਵਾਲੇ ਜਿਹੜੇ ਖੇਡਦੇ ਨੇ ਖਿਡਾਰੂ ਹੁੰਦੇ ਨੇ, ਫੁੱਟਬਾਲ ਦੇ ਖਿਡਾਰੂ, ਹਾਕੀ ਦੇ ਖਿਡਾਰੂ ਜਿਹਨਾਂ ਨੂੰ ਸੱਟਾਂ ਲੱਗਦੀਆਂ, ਉਹਨਾਂ ਵਾਸਤੇ ਇਹ ਬਹੁਤ ਕਾਰਗਰ ਸਾਬਿਤ ਹੋਏਗੀ। ਨਵੀਂ ਟੈਕਨੀਕ ਹੈਗੀ ਜਿੱਦਾਂ ਆਕਸਫੋਰਡ ਨੀ ਰਿਪਲੇਸਮੈਂਟ ਹੈਗੀ ਆ, ਇਹ ਹੈਗੀ ਆ ਪੈਟਲ ਫੈਮਿਲੀ ਜੁਆਇੰਟ ਰਿਪਲੇਸਮੈਂਟ ਹੈਗੀ ਆ, ਨਾਲ ਜਿਹੜੀ ਨੈਵੀਗੇਸ਼ਨ ਨਾਲ ਅਸੀਂ ਗੋਡਾ ਚੇਂਜ ਕਰਦੇ ਹਾਂ। ਇਹ ਸਾਰੀ ਨਵੀਂ ਟੈਕਨੀਕਸ ਹੈਗੀਆਂ ਜਿਹੜੀ ਅਸੀਂ ਹੁਣ ਲੁਧਿਆਣੇ 'ਚ ਲੈ ਕੇ ਆਏ ਹਾਂ।
ਡਾਕਟਰ ਤਨਵੀਰ ਜੀ, ਅੱਜ ਜਿਹੜੀ ਇਹ ਨਈ ਇੰਚ ਹੋਈ ਔਰ ਜਿਹਦੇ ਵਿੱਚ ਤੁਸੀਂ ਜਿਨ੍ਹਾਂ ਨੇ ਕਿ ਬੜਾ ਵਧੀਆ ਪਹਿਲਾਂ ਤਜਰਬਾ ਕਰਕੇ ਔਰ ਪੂਰਵ ਰਾਸ਼ਟਰਪਤੀ ਜੀ ਤੋਂ ਅਵਾਰਡ ਪ੍ਰਾਪਤ ਕਰਨ ਤੋਂ ਬਾਅਦ ਦੇ ਵਿੱਚ ਇਸ ਚੇਨ ਦੇ ਨਾਲ ਜੁੜ ਕੇ ਇੱਕ ਨਵੀਂ ਜਿਹੜੀ ਹੈਗੀ ਆ ਚੀਜ਼ ਨੂੰ ਤੁਸੀਂ ਪੇਸ਼ ਕਰਨ ਜਾ ਰਹੇ ਹੋ, ਕੀ ਕਹਿਣਾ ਚਾਹੋਗੇ ਅੱਜ ਦੇ ਮੌਕੇ ਦੇ ਉੱਪਰ?
मैं कहना चाहूँगा सब तो पहला कि मैं बहुत अपने आप को खुशनसीब समझदा कि मैंने डॉक्टर हरप्रीत ऑर्थोनोवा हॉस्पिटल के नाल जुड़न का एक मौका मिला, जो कि एक ऐसा सेंटर है जो कि ऐसी कई चीज़ां कर रहा है जो कि नॉर्थ इंडिया दे विच यूनीक हैं। ऑक्सफोर्ड नी रिप्लेसमेंट इंडिया दे विच किते नहीं हो रही, वो भी एशिया दे विच साडे हाईएस्ट नंबर्स हैं। सो इहदे विच जदों मैं कुछ कंट्रीब्यूट करन दी सोचदा तो आई फील ऑनर्ड कि मैं कुछ नवी चीज़ ऑर्थोनोवा दे अंदर शुरू कर सकदा, जिस तरह के स्पोर्ट्स मेडिसिन डिवीजन, जिस तरह के आर्थ्रोस्कोपी, जिस तरह के पेशेंट स्पेसिफिक नी रिप्लेसमेंट, जो कि अपने आप दे विच एक बहुत स्पैशलाइज्ड सर्जरी है। तो मैनू एक ऐसा प्लेटफॉर्म डॉक्टर हरप्रीत दे करके प्रदान होया, जिहदे नाल मैं सोच रहा कि असी इस हॉस्पिटल नू, इस चेन नू होर उंचाइयां तक पहुंचा सकते हैं तो पेशेंट्स का काफ़ी बेनिफिट कर सकते हैं।
सर, अज दे फंक्शन दे विच जिस तरीके दे नाल सारे जिहड़े हैगे ने डॉक्टर साहब दे टीचर्स भी आए और सारा लुधियाने च बड़ा वधिया मतलब एक फंक्शन मतलब जिहड़े हैगी आ होई आ, ਉਹਦੇ ਬਾਰੇ ਡਾਕਟਰ ਨੇ ਤੁਹਾਨੂੰ
जी, मैं सब तो ज़्यादा डॉक्टर एलिस चावला, डॉक्टर एस आहूजा, डॉक्टर बस्सी, डॉक्टर ND अवस्थी, डॉक्टर औलख, डॉक्टर रविंदर टार, डॉक्टर TN छडांगी तो बाकी होर सारे सीनियर डॉक्टर्स का जिन्हों का मैं शायद आज नाम लेना चाहूँगा तो सानू आधा घंटा लग जाएगा, बिकॉज लुधियाना के सारे टॉप मोस्ट डॉक्टर्स अपने अपनी फील्ड के जोड़े कि सारे दिग्गज हैं वो सानू आशीर्वाद देना आए साडे चेन की स्टार्टिंग के उपर साडे कोल इत्थे अपना टाइम कढ़ के अपना कीमती समय कढ़ के रात तक साडे नाल हैं। मैं उन्हों का हाथ जोड़ के अति दिल नाल धन्नवाद करदा हाँ तो ये उम्मीद रखता हाँ कि असी हमेशा उन्होंने आशीर्वाद के हकदार रहांगे तो असी अपना काम इस तरह बरकरार रखांगे। धन्यवाद।